In the bustling city of Upton, Essex, England, on April 5, 1827, a pioneering medical mind was born. Joseph Lister, the son of a wealthy wine merchant, would grow up to become one of the most influential figures in the history of medicine, transforming surgical practices and saving countless lives through his groundbreaking work in sterilization and antiseptic surgery. Joseph Lister's early life was marked by privilege and education. He attended prestigious schools and later studied medicine at University College London and the University of Edinburgh, where he trained under some of the leading medical minds of his time. Little did he know that his journey would lead him to a profound discovery that would change the face of surgery forever. In the mid-19th century, surgery was a perilous endeavor. Infection was rampant, and postoperative mortality rates were shockingly high. The prevailing theory at the time, known as the miasma theory, held that infections were caused by foul odors and bad air rather than microscopic pathogens. Lister, however, was deeply influenced by the groundbreaking work of the French scientist Louis Pasteur, who had demonstrated the role of microorganisms in fermentation and putrefaction. Drawing from Pasteur's germ theory, Lister became convinced that these invisible microbes were also responsible for postoperative infections in surgery. In the 1860s, Lister began conducting experiments to prove his theory. He introduced the concept of antiseptic surgery, which involved the use of chemical agents to disinfect surgical instruments, hands, and operating rooms. He advocated for the use of carbolic acid, phenol, which had antiseptic properties, to cleanse wounds and surgical equipment. Lister's work led to a dramatic reduction in postoperative infections and deaths. His pioneering efforts were met with skepticism and resistance from the medical establishment, but he persevered, meticulously documenting his cases and outcomes. Over time, the evidence in favor of antiseptic surgery became undeniable. In 1867, Joseph Lister published a seminal paper titled On the Antiseptic Principle in the Practice of Surgery, which outlined his methods and results. His work revolutionized surgical practices and marked a turning point in the history of medicine. Lister's antiseptic techniques soon gained widespread acceptance, and they were adopted by surgeons worldwide. His innovations extended beyond surgery, influencing hygiene practices in hospitals and shaping modern medical sterilization procedures. In recognition of his groundbreaking contributions to medicine, Lister was knighted in 1883, becoming Sir Joseph Lister. He continued to teach and inspire future generations of surgeons as a professor at King's College London. Sir Joseph Lister's legacy endures in every surgical theatre and medical facility where sterilization and antiseptic practices are employed. His pioneering work in understanding and combating infection has saved countless lives, and his commitment to scientific inquiry and patient well-being has left an indelible mark on the field of medicine. Joseph Lister's story is a testament to the power of innovation, dedication, and the enduring impact of a single individual's commitment to the betterment of humanity's health.